Hey guys, this is Fixer Med. Welcome back to my high yield genetics review for the USMLE Step 1 NBME CBSE and NBME CAS examinations. This will be part 9 of my multi-part video series covering the entire discipline of genetics in a comprehensive but high yield manner. So without further ado, let's go and get started on today's content. Today I'd like to open up by talking about personalized medicine. Personalized medicine is also known as precision medicine, which involves tailoring medical treatment and interventions to individual patients based on their unique genetic and environmental lifestyle factors. Personalized medicine aims to optimize therapeutic outcomes by considering variability in genes, environment, and lifestyle. Personalized medicine utilizes advances in genomics, proteomics, and other omics technologies to develop targeted therapies. Some applications of personalized medicine include cancer treatment, where genetic profiling of tumors guides the selection of targeted therapies, pharmacogenomics, which predicts drug response based on genetic variations. Moving on. Next, we're going to be focusing on pharmacogenomics. Pharmacogenomics is a study of how genetic variations influence individual responses to medications, including drug efficacy, toxicity, and adverse reactions. Pharmacogenomics explores the interplay between genetic factors and drug metabolism, transport, and receptor interactions. Pharmacogenomic testing identifies genetic variants associated with drug response to inform personalized prescribing, determining optimal drug dosages based on individual genetic profiles, predicting the risk of adverse drug reactions and drug-drug interactions. Moving on. Genomic testing. Genomic testing involves analyzing an individual's DNA to identify genetic variants associated with disease risk, diagnosis, treatment response, and prognosis. Key concepts of genomic testing involve the fact that it encompasses various types of genomic tests, including whole genome sequencing, exome sequencing, and targeted gene panel testing. Genomic testing informs clinical decision-making across various medical specialties, including oncology, cardiology, and rare diseases. Some applications of genomic testing include diagnosing genetic disorders and rare diseases, guiding treatment selection and personalized therapies based on genetic biomarkers, and assessing disease risk and implementing preventive strategies based on genetic predispositions. Moving on. Let's approach some questions now. We have a 55-year-old patient with hypertension who is prescribed a new antihypertensive medication known as Drug X. Pharmacogenomic testing reveals that the patient carries a genetic variant associated with reduced activity of a liver enzyme responsible for metabolizing Drug X. Which of the following is the most likely outcome for this patient? Alright, think I gave you guys enough time here. So moving on now, if you need more time, pause the video. The patient's genetic variant associated with reduced activity of a liver enzyme responsible for metabolizing Drug X suggests that the patient may metabolize the medication more slowly, leading to decreased drug clearance and potentially lower than expected drug levels in the body. This scenario could result in reduced therapeutic effects of Drug X. Therefore, the correct answer is E, reduced therapeutic effects of Drug X. Moving on to see why the other answer choices are incorrect. Increased risk of adverse drug reactions. While reduced metabolism of Drug X may lead to higher drug concentrations in the body, potentially increasing the risk of adverse effects, the primary concern in this scenario is the reduced therapeutic effects of the medication. Improved efficacy of Drug X. A genetic variant associated with reduced metabolism of Drug X would not improve the efficacy of the medication. Instead, it would likely result in lower drug levels and reduced therapeutic effects. Decreased likelihood of drug-drug interactions. The presence of a genetic variant affecting the metabolism of Drug X does not necessarily decrease the likelihood of drug-drug interactions. Drug-drug interactions can still occur based on the pharmacokinetics and pharmacodynamics of other medications. Faster clearance of Drug X from the body. A genetic variant associated with reduced enzyme activity typically results in slower drug clearance from the body, not faster clearance. Therefore, this option is incorrect in this context. Moving on to the next question. We have a 40-year-old woman with a family history of breast cancer who undergoes genomic testing for hereditary cancer risk assessment. The results reveal a pathogenic variant in the BRCA1 gene. Which of the following is the most appropriate next step for this patient? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. If not, moving on and now. The identification of a pathogenic variant in the BRCA1 gene known to significantly increase the risk of breast and ovarian cancer warrants consideration of risk-reducing interventions such as prophylactic mastectomy. Prophylactic mastectomy has been shown to substantially reduce the risk of developing breast cancer in individuals with BRCA1 mutations. Therefore, the correct answer is consider prophylactic mastectomy. Moving on to see why the other answer choices are incorrect. Initiate regular screening mammograms. While regular screening mammograms are essential for breast cancer detection in the general population, they may not offer sufficient risk reduction for individuals with BRCA1 mutations. Prophylactic mastectomy is often recommended in these cases due to significantly elevated cancer risk. Prescribe a targeted therapy for breast cancer prevention. While targeted therapies may be used in the treatment of breast cancer, they are not typically prescribed for primary prevention in individuals with BRCA1 mutations. Risk-reducing surgeries such as prophylactic mastectomy are more effective in reducing cancer risk in these high-risk individuals. Discontinue genomic testing. Discontinue genomic testing after identifying a pathogenic variant in a cancer predisposition gene like BRCA1 would not be appropriate. Continued monitoring and surveillance are essential for managing cancer risk and providing appropriate interventions. Recommend lifestyle modifications. Lifestyle modifications such as maintaining a healthy diet and regular exercise are important for overall health and cancer prevention, but they may not offer sufficient risk reduction for individuals with BRCA1 mutations. Prophylactic mastectomy and other risk-reducing interventions are more effective in this high-risk population group. That will do it all for this video today, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. Also, would appreciate it if you guys would consider leaving a like and potentially subscribing to the channel for more content like this. Otherwise, that's all I have. This is Fixer Med, signing off. Be sure to have a great day, everyone, and good luck studying.